Hello friends, my name is Dr. Priyanka. Today I am going to discuss you a fantastic case of HLH beautifully described by my student named Devanshu. Later on I will discuss a slides of this.
Today we are going to learn HLH, that is lymphohistiocytosis. It is a rare life-threatening condition which is due to hyperinflammatory condition and dysregulation of cytokine production. There are two types: primary familial HLH, which is due to genetic mutation of perforin 1, MUNC13-4 and syntaxin binding protein. The common age group of this is less than 1 year. And second, that is secondary acquired HLH. It is due to infection, malignancy, autoimmune disorder and drugs, and the common age group is elderly. The pathophysiology is there is defective cytokine function which can lead to uncontrolled immune activation and cytokine storm. This leads to the failure of cytotoxic T cell to clear antigenic stimuli, and there is excess of activation of macrophages and CD8 T cells. These activation of macrophages cause hemophagocytosis in bone marrow, spleen and liver. Histopath finding is in bone marrow is hemophagocytosis, that is macrophages engulf RBC, WBC and platelets, and hypercellular bone marrow can be observed. Secondly, in spleen and lymph nodes, there is splenomegaly due to infiltration of macrophages and T cells, and lymphadenopathy due to decrement of lymphoid follicles. In liver, there is hepatitis-like picture, that is necrosis in hepatocytes and activation of the Kupffer cells. In CNS, there is perivascular lymphocytic infiltration. The clinical features are prolonged high fever, seizures, encephalopathy, coma, hepatosplenomegaly, and bleeding tendencies. The lab finding and investigation, there is liver function test in which there is increase of ALT and AST, the liver enzymes, and in CSF analysis, there is increment in protein and WBC. We can also observe pancytopenia, hyperferritinemia, that is increment of serum ferritin, and high soluble interleukin 2 receptors, hyperfibrinogenemia, and CD8-25 disruption. The treatment is steroidal treatment is given in this condition.
So this is a case of a 37-year female presented with bicytopenia, having a anemia and thrombocytopenia. The clinician was suspecting leukemia as the patient was having mild splenomegaly also. Later on, the bone marrow examination was performed, and this is the image of a bone marrow showing hemophago-lymphohistiocytosis activity with hematopoietic cells engulfed by macrophages, as you can see in the images described. The hematopoietic cells which are engulfed are NRBCs or erythroid series, along with myeloid series which are engulfed by the macrophages. So in brief, one should look for molecular diagnosis along with following hematological parameters like bicytopenia, fever, splenomegaly, and disarrangement in lipid level, along with increased ferritin level. So one must fulfill all these criteria before labeling it as HLH. Please, thank you, like, share and subscribe my channel.